Panelists, we would like to start our evening off on a note of positivity. So as I introduce you, please briefly share with us one hope you have for youth in our community. First, I would like to introduce Karen Pershing. Karen is Executive Director of Metro Drug Coalition. Karen is a 30-plus year veteran of public health who has devoted her career to improving the health of families in Knoxville. She works with state policymakers to advocate for laws that help prevent substance misuse and its consequences. Karen, what is your hope for our youth?
Well, I'm always that one who sees everything through rose-colored glasses. So I guess my biggest hope is that every child can be raised in a community and in a home that's healthy, where they feel safe, and where they can thrive.
Thank you. I think we'd all like that. Thank you. Next, join me in welcoming Dr. Emily Woodrum. Dr. Woodrum is a licensed clinical psychologist working as a behavioral health consultant at Cherokee Health Systems, Alcoa Clinic, specifically working in the medication-assisted treatment clinic. Dr. Woodrum provides behavioral health care to patients receiving Suboxone, Vivitrol, I hope I'm saying that correctly, and I always have a hard time with these drugs. Naltrexone. Thank you. Those are treatments with a harm reduction and supportive approach. Dr. Woodrum, please share your hope for the youth of our community.
I hope that our children and youth are able to learn coping skills for whatever comes their way and really find a very supportive community and network within wherever they choose to do so.
Oh, and that support is so important, whatever we're going through for all of us, of all ages.
Absolutely.
Well, thank you for that, Dr. Woodrum. Our next panelist is Caro Douglas. Caro is a graduate student at the University of Tennessee, Knoxville in the College Student Personnel Program. She currently serves as a graduate assistant for health and wellness in the Office of Sorority and Fraternity Life. Caro, what is your hope for Knoxville's youth?
Yes, absolutely. So I work with a lot of students every day, and I know that the students that I work with have been so passionate and they want so much change in this world. And I think the biggest thing is them taking charge of their own narrative when it comes to their wellness and really, wanting to take those actions to be better, to have those healthy relationships with some of these substances.
Oh, yeah. So important, their own narrative. I think that's important. Well, thank you for being here. Next up, we have Dr. Shults, a pediatric doctor here in Knoxville. Dr. Shults is a board certified in pediatrics and began practicing pediatrics in the Knoxville area back in 1994. Dr. Shults, please share your hope for our youth.
That we can help them to be all that they can be and just support them in any way that they need it. I know through COVID it's been really tough. We've seen a lot in our office with the way they've had to deal with that stress in their lives, and I think it's just something that I feel like that any support that we can give for that as they're coming as we're coming out of the pandemic would be great.
And I think so many people don't understand that. I think because we've never been through anything like that. Well, thank you for being here, Dr. Shults. And last but not least, please join me in welcoming Lieutenant Josh Shaffer with the Knoxville Police Department. Lieutenant Shaffer has been with the Knoxville Police Department since June 1998, where he began as a police cadet. He currently serves as a supervisor in the Criminal Investigation Division. Lieutenant Shaffer, what is your hope for the youth in our community?
My hope is whenever we look at the next generation that the youth of today that have gone through, like the doctor said, the COVID pandemic, they've also gone through, they've lived their entire life in what we know is the opioid epidemic, and see an ever-changing technology landscape that seems to change on a daily basis that a lot of us feel uncomfortable with, that next generation will use the coping skills, the ability to adapt, the ability to transition to the world that's around them, to look and discover long-term solutions to, issues like substance abuse, the opioid epidemic, potentially getting into homelessness with the skills that they have and the technology that they have that we didn't.
It's so good to see that you all have hope for everything that we hear. We seem to hear so much of the bad. It's good to see that there is hope amongst our community leaders. We appreciate you being here, Lieutenant Shaffer, and we appreciate all of our panelists being here. Thank you for being here. We look forward to learning from you in tonight's discussion. Well, we're going to just go ahead and dive in because we have a limited amount of time and it's going to go a lot faster than we think it will. An hour is not much time. We're going to go ahead and dive in with the first question for Lieutenant Shaffer. Lieutenant Shaffer, what trends are you seeing right now regarding youth substance abuse?
Talking specifically with youth, and I want to talk about the school age as opposed to even prior to college age. One thing that we've seen that's a little alarming, and then just within the last year specifically, it's kind of twofold. Number one is vaping in schools, which obviously started out as an alternative to smoking cigarettes, nicotine vaping. But what we're seeing now is a transition into vaping THC cartridges. Whenever we're conducting drug investigations or we're conducting search warrants, we're intercepting packages that are related to marijuana drug trafficking organizations, particularly out of the West. We're seeing more and more and more THC cartridges that are being produced, that are being manufactured. And in turn, we're seeing that in the schools. Our SROs in the school system are starting to see more and more of that. Also, in conjunction with that, also in the schools that we're starting to see more and more, and in talking to law enforcement across the state, are the THC or the variations of the various types of THC. And I know there's a lot of legislation now being discussed about that, but the CBD or THC gummies that are coming out that are making their way into schools as young as middle school even, where kids are bringing them. And if you've never seen these, a lot of them are packaged like Starburst, or they're packaged like candy. They're colorful. They're cartoon characters. It looks like something you would see at Kroger's, and they're bringing it and passing it around at school in certain areas, and that's creating an issue. In addition to that, what we're seeing that I'm afraid it or potentially could start affecting the youth, whenever we look at fentanyl specifically, is a lot of fentanyl that we're seeing on the street is in the form of counterfeit pills. So, somebody may think they're taking one thing when in reality it may be there's a good chance it's fentanyl. And the drug trafficking organizations, in an attempt to disguise them, are making them in various colors. And so is that going to start making its way in a more prevalent manner in the colleges and things of that sort? I think that's definitely something to be on the lookout for.
But with this being seen in middle school and high school, the parents see these gummies and think, well, it's just gummies. They don't even know maybe that it's edibles. Or they see vaping and think, well, it's just vaping. It's not THC. It's not something serious. So it may be. So parents watching tonight might want to pay attention a little more to what the vaping is, because it could be very more serious than you're even thinking it is. Now, Dr. Woodrum, what are the serious consequences of drug and alcohol use by adolescents?
So various concerns develop with use of any type of substance, but especially with youth. What we know is the brain is developing and continues to develop well into the 20s. And so especially that frontal lobe can be so much impacted by any substance use. And that's such an important part of our brain where we learn to plan and manages impulsivity. And so it's that can be a concerning part on that side of it, the brain development side of it. But also, and you'll probably hear this a lot from me today, is if we're using substances at a young age, we're not going to learn these coping skills, learn how to adapt and manage these difficult situations, but instead use substances as a way to maybe suppress those emotions. And then coming into adulthood where there might be less support and more stressors, they're not having that practice and that guidance of using appropriate coping skills if they're using substances as a way to manage that. So those are my primary concerns that I see with these substances at a younger age.
I think it was on one of the trivia questions you guys had on your Instagram account this week. When does the brain fully develop? And it was age 25, I believe, on average. That's youth using anything is really affecting that. So with an 18-year-old child, and those things people remind me I have an 18-year-old adult, really. Caro, what are the things that are most commonly used substances on college campus?
Yeah, absolutely. And, being a recent graduate myself, as well as working with college students every day, I think obviously the biggest one is alcohol, right? But I think additionally, kind of more of your party drugs, so marijuana, cocaine, but something that we've kind of seen more that I definitely saw in college myself was the use of Adderall. So a lot more study drugs, which can be concerning, especially based off what Officer Shaffer said.
Mm-hmm. And that's not just the use of Adderall, but the misuse of Adderall.
Mm-hmm. Absolutely.
So, Dr. Shults, how does youth substance use impact development?
Well, definitely in a developing brain, like you said, the brain doesn't develop until age 25. So you're going to have more impulsivity and decision making that's not appropriate. And so the kids are going to have possibly get into more trouble, and then we see increase in suicidal thoughts, increase in other, depression and anxiety and things like that. I know in my practice, we've had an increase in those diagnoses over the last few years anyway.
Mm-hmm. And do you think that is because, and I know it's unfair to ask this probably, but do you think the pandemic had something to do with that, or did that just accelerate maybe some of the anxieties and things that people had anyway?
I think probably a little bit of both.
Mm-hmm.
I mean, I think for sure, that insecurity that everybody was feeling, even though the kids, most parents tried to make things as normal as possible, mm-hmm. but, they knew that they weren't able to do the things that they were before. And so I think those friend groups and the ability to, feel like you are included and a part of something. And I think the whole, we see a lot of trouble with, all the internet and Facebook and anything that the kids do like that to communicate. It's so much easier to bully and be mean-spirited. And so I think they were communicating more in that fashion and not able to actually see and see people and actually, talk to people and touch people. And that's just very important for all of us.
And the written word is so open to interpretation in a different way. So, Karen, we have to ask you, how can we start a conversation with kids about substance use in general, and what age is appropriate to start that conversation?
Well, here's what I tell people is, good health and well-being really starts as young as they can start understanding things. So there's building blocks up to the subject necessarily of substance misuse. So teaching even younger children, how important it is to eat healthy, and that food is fuel for your body, and whatever you put in your body, you want to put good things so that you'll be healthy and grow and develop. So brushing your teeth, bathing, all of those are like basic things which seem very simple, but they're, again, a building block for when they get to the next phase in their development. And then you build on that. Exercise, all of those things. You're, again, teaching kids to have a healthy respect for their minds and their bodies based on what they're putting into it and what they're involved in. So as they get, again, older, like late elementary school, you're going to start having conversations about nicotine, especially alcohol and marijuana. Of course, usually the three drugs that kids experiment with early. And so having those conversations about what those substances could do to their bodies, again, is an important conversation to have. But it's also good, you have teachable moments, as you're parenting your child. So sometimes, again, being that askable parent and that no subject is off limits is extremely important. So even though your child may come to you and go, oh my gosh, why are they asking me that? It's good for a parent to have that poker face and literally not be reactive when they ask you something, because again, parents are the key. And I think a lot of times we forget that, especially when they do get to adolescence and they do the eye rolling. They're doing the eye rolling, but they're still listening. And I think parents sometimes think when they get to high school and they start hanging around with peers and they do the eye rolling, that they're not listening, but they are. Mm-hmm. So talk early, talk often, and use those age-appropriate building blocks.
I know my son, whenever there's a car accident with drunk driving with teens, or, like we're in prom season and things like that, he'll go, are we going to talk about alcohol again? Yes, we are. So, he just knows it's coming and we talk about it, but, he is listening, hopefully. This comes from someone in our audience, Dr. Woodrum. I'm a grandparent that has custody of their grandchild because of parental substance use and involvement with the criminal justice system. How can I help them so they don't go down the same path? A lot of that.
Absolutely. And I think that's a really great question because it's, it has become so prevalent. And I think exactly what Karen was saying is having these conversations and being honest with the kids. Of course, always in a developmentally appropriate way, in a way that they can understand it. But being honest and upfront about that this is also a genetic component. We know how addiction can be hereditary in some ways, and so knowing that they might be more predisposed to that might be a conversation as they get older. But when there's questions about, why is mom not here? Why is dad not here? It's okay to have those conversations and to talk about that. Just being sure that we're talking about it using words that they can understand, which will vary from age to age. But I think having that communication, having supports in place is really important to have. So whether that's the grandparent themselves or another really trusted adult that can help and support them. And even being prepared for maybe this is something they need to talk about with someone who's professionally trained to process and understand, what's happened to where they've started living with grandparents. So I think a lot of different things we can do, but just really listening to the kids and talking with them openly about it is really important.
Caro, in your opinion, what is the most effective way to reach college students regarding the dangers of substance misuse? How do we get them engaged so that they actually hear what we are saying? Ooh.
Yeah, I think one of the biggest things that college students value right now is authenticity and transparency. So I think when we want to have conversations with college students about, substance misuse, it's being truthful, being real, and, not just speaking at them, but wanting to have a dialogue, wanting to have a conversation. And so, when you want to work with college students, don't just say, hey, here's this flyer, hey, look at this website, but actually stop them and say, hey, let's have a conversation, like be intentional, be authentic, and actually want to get to know them when you're having that conversation, not just talking at them. I think they just want to, even post-COVID, just have a conversation with people and be real. And especially when it's topics, just like these, it's going to need authenticity and transparency. So that's what I think.
What when they say, well, did you ever do this?
Well,
that's the hard question.
Yeah, that is the hard question. And that's when you say, we're not really talking about me right now. We're talking about you. We want to talk about you and your experience, not mine.
Yeah.
I think just, trying to have them lead the conversation instead of you.
Because a lot of people ask that. Had to throw that out there. All right, Dr. Shults, how can caregivers or guardians utilize their pediatrician as a resource in guiding and educating families about medication safety?
I think you just need to have an open conversation with the physician that you're going to. We want to help you And so we're open to questions. We're open to comments. I think, every family is a little different in how they deal with things. And so I think I usually take it case by case and talk with the family and find out a little bit about how they deal with that, with medicines within their home and how they talk with their kids. And then you just kind of tailor it to where you see that whether there's a risk there and how many kids are in the home and who's in and out of the home and that sort of thing, just so you can make sure that you make it as safe as possible for them and their family.
Where do you suggest someone keeps their medications?
We try. You want to make sure that it's in an area that they aren't able to get to. I think it depends on the ages. If it's small children, then definitely as far away as you can get that they can't get, and think that they can get to it because they can climb, they can get into things, they can unlock things. So I do think that you have to be very careful and just make sure that they don't really understand what's in there and why you're doing it. I think the more you try to show, sometimes the worse off it is, because then they're watching and making sure.
They want to know what's in there.
Exactly.
Metropolitan Drug Coalition does have lock boxes that you can get, so you can look into information on that as well. So if you have a need for that, you can certainly look into that as well. Lieutenant Shaffer, I recently learned about the social host law. I've always thought that if my child and their friends are going to drink, it's better for them to do it at my house in a safe environment. Haven't we all heard that before? Why would I be punished for trying to keep my child safe?
Well, I guess this is where the policeman becomes the party pooper. So in looking at that, it's kind of, I think there may be some misconception in what the social host law really is. So the social host law is actually deals with civil law, which law in the criminal justice system doesn't deal with. Basically, whenever you look at a business that sells alcohol, whether it's a bar or something of that sort, there's things civilly in place called dram shop laws, where basically alcohol establishment, particularly a server, can be held civilly liable for injuries to a third party. Prime example, bartender overserves somebody, they leave an establishment, get involved in an accident that injures or kills somebody else. That establishment or that individual server could potentially be sued civilly. Again, it's a civil process for those injuries to the third party. What the social host law is deals with people who provide alcohol but not as a business, that are not selling it. It's somebody has a house party and people come over and they give them beer, they give them alcohol out of their refrigerator. And again, it's not a business, it's a social host. And Tennessee is one of the states that, without there being something egregious, and again, what I know of it civilly, without something very egregious, the host cannot be held civilly liable for those actions. But whenever you start getting into an underage person and the way the question's phrased of getting in trouble, the social host law doesn't apply to the criminal justice system and to the criminal side. In the state of Tennessee, it's illegal for an adult to knowingly provide someone underage with alcohol, whether they sell it or give it away, or make it available for them, whatever the case is. And that's done for a purpose. It's the legislatures over the years have decided with obviously with the direction of medical and psychological professionals that someone under 21 shouldn't consume alcohol, and that's why the law is there. And therefore, it's against the law for someone to go against that and to provide someone underage with that. So that's the reason that the law is in place. And we do hear, and I heard you kind of chuckle. Well, haven't we all heard that? Well, isn't it safer if they're going to drink anyway? Let's have it here. Well, and at that point, and I think that's where you could start walking down that slippery slope of, well, if they're going to do it anyway, I'm going to let it do it, and I'm going to set the parameters. Well, at that point, you're condoning the activity, and where does it stop? If it's alcohol now, well, the law says it's illegal for someone under 21 to drink, but I'm going to let you do it. Well, the law also says you can't use marijuana. Well, the law also says you can't use this drug. The law also says you can't use that drug. And at what point do we expect someone without a fully developed frontal lobe to be able to make that rational decision in their mind? And I think that's the slippery slope you got to be careful of. If you're trying to watch out and to do what's right, I think it's to encourage, and she mentioned having a dialogue and to show with the college students, having a dialogue to let them engage and not just say this is the way it is, period. But I think as a parent, I think as a guardian, I think as a mentor, as opposed to just saying you can't drink here, end of story, explain why. Whether it's the dangers of it, whether it's the mental development, all of those things. I can, without getting into the details, I can tell you multiple stories where parents hosted a party for their children or for their children's friends because it was safe, that ended in a traffic fatality. And so, again, it's one of those things. At what point is it condoning, and then what's that potentially going to lead to?
You think it's safe while they're there under your roof, but then they leave and all safety's out the door and it's just too much at risk. Thank you. Karen, someone from our audience as well is saying, I saw that the Knox County Youth Risk Behavior Survey, we've all heard about that, that the results were released. What substance use trends are we seeing in schools right now?
Well, we're definitely seeing that alcohol use is still king. And we've been seeing that since we started the surveys. Again, it's very accessible, whether it be in the home or out in the community. And so alcohol itself is part of our culture. And I think with that cultural integration that alcohol plays in our community and in our country, it just is, again, much more accessible, I think, to young people, and there's less stigma around, using alcohol versus illicit substances. Definitely, as Lieutenant Shaffer mentioned at the beginning, vaping is extremely popular right now among our young people. And again, the concern is we don't want them vaping nicotine, but definitely there's a lot of these THC cartridges, and right now there's nothing illegal about purchasing these. There's no age restriction, and so as adults and parents, we all need to be very concerned about that. We need to be advocating that our legislators do something about Delta 8, Delta 10. Delta 9 is what is the THC that's in marijuana, which is illegal still in the state of Tennessee. But these hemp-derived THC, like Delta 8, are not currently illegal. So any young person, regardless of age, can go purchase them now. So there should be some regulation around these products in our state, and there should be age restrictions. So I think that would help a lot with that particular problem. And then, of course, just marijuana has been popular for quite some time. The good thing is prescription drug misuse among our youth has been going down for several years now. Again, the concern about fake pills for the ones who are still engaged in misusing prescription drug abuse is extremely concerning for all of us that are adults and love our children. Only one of these pills could kill our child. And so we need to be having a lot of conversations about fake pills and not taking a pill that you don't know what it is or where it came from.
Well, what we're hearing about fentanyl, you can even touch something that has had contact with a powder of fentanyl and can kill you. So it's very scary stuff, and I don't think some people understand that. Dr. Woodrum, we have a follow-up comment from a question that was asked earlier. The quote was, what they're saying is, you can't tell your children when they ask you about your past that Well, we're not talking about me. You have to be upfront and honest with yourself and children about drugs and alcohol and any addiction in your family history. Can you share your thoughts on this? I think they're going back to where Caro said, well, we're not talking about me right now. We're talking about you. They want to know what your thoughts on that question is if they say.
Yeah, so I think it can be very individualized to the family, absolutely. While again, it can be this sense of being honest, but in a very developmentally appropriate way. Just as an example, I will talk with families about, maybe we don't necessarily say that like mommy's sick, but instead saying things like because if mommy's sick, that might mean she has strep throat or she has a stomach bug, and that's hard to understand. Because that's what feels familiar for the child. But maybe saying things like, mommy is having a tough time where she's trying to make decisions to help her feel better. But so in that regard, we can, again, developmentally approach it appropriately. And then I think dependent on kind of the age and development level of the child, there can be some level of honesty, but we also want to really help support the child in what they're going through in that moment. And if that might not always necessarily mean we need to talk about what the parent exactly has gone through or experienced, if that makes sense. But just being kind of keeping it child focused while having some level of openness is okay, dependent on the situation, I would say.
So not necessarily I did everything in the world, but I don't want you to do that.
And all of these details,
Yeah.
but maybe more of, maybe I've struggled with this, but this is maybe what's helped me. Again, dependent on the age, there's such a wide variety, but
Okay. Well, Caro, we have a question for you now. I'm sorry, this is an addendum here as well. The individual that commented wants to know how to discuss this with teens. Any panelist can answer that is, how do you discuss this with them, your past use or misuse of drugs, alcohol, any of this? Anybody have any comments?
I think, again, it's important to be honest, but also to not glamorize, any past use, and actually talk about consequences that you may have experienced during that period of time in your life. Because, again, kids learn if they can learn from your mistakes, or they can understand the consequences potentially if they go down that path, then I think that's a great teaching moment for them. But I think it's extremely important for kids to understand that there's always going to be consequences. And those consequences could be different for each adult, each parent. Some may have had some serious consequences, and others it may have been a minor thing. But I think, again, it's important for them to understand, even if it was a minor consequence, what the long-term impact even of that little blip in their lives. And again, saying, I wish I'd never made that decision, and that was not a good decision for me, so that they, again, understand that fully.
Anyone else? I think also when you were talking about minor consequences, if you will, that maybe that consequence was you realizing I was going down a path I didn't want to go down, and I saw where it was leading. Sometimes that's the consequence.
Absolutely.
You stop yourself, or your friends say, hey, do you see where you're going? So maybe that can help. Caro, we have a question for you. Is there an issue with underage drinking on college campuses? Seems like an obvious.
No.
Yeah, isn't it? If so, how are universities and colleges working to resolve this? That's the part I want to hear. Yeah, from the inside.
Yeah, I think universities and colleges are really trying their best. I think that's a hard issue to tackle. I think a lot of things, on the positive side, universities have tried been providing, additional programming that doesn't have, isn't surrounded around alcohol, whether that's a concert or having a speaker or having a game night or whatever that looks like. But I also know, on the other hand, they're also trying to get resources out, trying to have those conversations with students, even when they don't necessarily want to have them. I know, additionally, universities have been coming out with, amnesty policies, help, if you do make that mistake and you need help, like, you will not be held, responsible per the university, and they'll try to help you. So it's really, yes, we want to provide opportunities for you to do fun things without alcohol or drugs, but also helping you get more educated and getting you the resources even after something happens or you do make a mistake.
Now, Lieutenant Shaffer, we know underage drinking is a big problem in Knoxville. What advice do you have for guardians?
I think it just hitting on what a couple of the previous questions and answers, and even one of the ad lib questions there, is having those conversations and having, especially when they get to college age, they're at a point that they can understand a little more reality than even a high school kid. They've probably, unfortunately, in this day and age, they've probably seen tragedy as a result of drugs and alcohol by the time they go to college, whether it's within their own family or within a social group or within the high school. So I think it's, don't dwell on the negative, and don't, have a dark cloud that follows them everywhere, but remind them of consequences, and remind them that, the majority of those individuals that something tragic happened didn't intend on that to happen. They just got into a place where they weren't able to make sound decisions in the moment. And that can happen to anybody. That can happen to any one of us. And I think just a little bit of that reality check. And again, it's not don't do it, period, here and end of story, but don't do it, and here's why. And, surrounding it with love and concern. I'm not trying to be mean. I'm not trying to be, that mean parent. I'm doing it because I don't want this to happen, or I don't want these negative things. And as parents, look for signs, look for opportunities. And I know it was brought up, look for doors to open to have conversations. And if a child comes home on spring break, if a child comes home on a holiday, on the weekend, and it appears, or you see signs, don't just discard it and say, well, my child would never do that. Don't let an opportunity pass to bring something up that may be a hinge point in that child's life, and be willing to have those tough conversations, even if it's tough for you, because whether it's alcohol that potentially could turn into other things, or drugs, or being the victim of a crime, which unfortunately can happen as well. Literally a split second, somebody who's under the influence of alcohol, whether it's walking down a road or getting behind the wheel of a car, it can literally take a second, and you'll never get those opportunities that you had in the past to bring it up.
Can I make another comment
Yes,
on
absolutely.
that, the college campus thing? I think part of what we have to look at is the cultural norms within college campuses, and the fact that, it becomes a rite of passage, so to speak, and there's a certain level of acceptance on college campuses that's going to happen. But I think colleges and universities can do a lot in terms of having safe, fun activities that don't involve alcohol. And again, we as adults too need to be modeling that too. So if we have college students and we can't have a social event or do anything without alcohol, again, we kind of plant that seed, right? You can't have fun. You can't go do certain activities unless there's alcohol involved. So again, I think, we all play a role in that, changing that cultural norm and those social expectations.
That's a very good point. Dr. Shults, this comes from our audience as well. I've known people that leave the doctor's office with a prescription for pain pills and end up getting addicted very quickly, even when using appropriately. What advice would you give someone that's prescribed something that is addictive?
Well, I think you have to try to understand yourself in that situation, and be very careful and ask lots of questions. I think most physicians are going to welcome questions from you. When my patients ask questions, I want to answer those. I want to help them understand why we are using this medication, how long you should use this medication, and feel free to call me back if you feel like that you have other questions or different things have happened because of that medication. I mean, for instance, in my office, we prescribe a lot of ADHD medications, and so we make sure that we don't give refills unless you have been in for your rechecks. Because we want to make sure that you're taking the medication appropriately and that you are, that any questions that you might have, that we can answer those at that time.
And I know some people get frustrated that I have to go in again to have a recheck, but there's a reason for that.
Definitely. I mean, we're just checking to make sure that everything is going well and that there aren't issues with that medication, because those medicines can cause trouble.
Thank you. This is from our audience as well. Karen, I've heard so much about mental health and substance use, and I would like to get involved to help improve both issues, but it seems like there's nothing I can do. Do you have any ideas about how I can help my community?
Oh, lots of ideas.
Boy, have they asked the right
I'm never
question.
short on those. So, as far as mental health, there's definitely a lot of trainings available out in the community. MDC, Metro Drug Coalition, actually offers trainings on mental health first aid. And those are designed for laypersons. You don't have to be a mental health expert to take these trainings. But what they help you do is to recognize early signs and symptoms that someone in your life may be struggling with their mental health. So if you can identify that early and intervene with your friend or a family member, then hopefully you can prevent serious mental illness by being neglected for so long and get them into care if they need care early on. But you can also avoid them self-medicating using substances. So it's extremely important. Getting, on a listserv and keeping yourself educated on the latest drug trends. And I know nobody likes to talk about those things, but at the same time, information's power. And the more information you're aware of and you understand what's going on in your community, the better you can make your own environment and your own sphere of influence much safer. And again, you can have meaningful conversations, but if you're talking about something that happened 20 years ago, your kid, again, that eye rolling thing. But, you have to understand what they're dealing with today so that you can more appropriately intervene. And so it's important for those of you who are joining us tonight, you're being proactive and you're educating yourselves and you're learning. You can always contact us. We can provide trainings and information. We can get you into mental health first aid training. And again, information's power.
This is from our audience. For any of our panelists, how can you help a teen with a substance use disorder or a suspected substance use disorder? You touched on that a little bit, Lieutenant Shaffer, if they don't wish to stop using.
I'll take part of that. So we talk a lot about in the field that motivation is incredibly important to want to make change. But sometimes it's not always there immediately. We have a lot of techniques in the therapy world to kind of work to build motivation. So it can even be, if they're not ready for a full on, inpatient stay or detox facility or whatever the case may be, it might even be just entering in and starting the process with therapy. So that way folks can better understand maybe the use, why, other coping skills. And like I said, we have a lot of techniques that we use to help build motivation in folks. So if, big steps aren't quite ready yet, maybe those smaller steps. But again, we've talked so much about this already today, but just continuing to have the conversation and not pushing that under the rug and just keep talking about it and having a dialogue for that.
Anyone else? It's hard to imagine someone being on something and not wanting to stop misusing, isn't it? But
It's well, it's the dynamics within the brain of addiction, and that's why we refer to it as a disease and view addiction as a disease. It often feels like it's not so much a choice, and it's not. And so definitely finding the correct and most helpful treatment, individualized treatment for you, and that can vary from person to person, but ultimately seeking that out when ready. And we have a lot of, skills and strategies that we use to help you get there.
and I guess that's why if we don't misuse, we don't understand that. So it's we have to keep that in mind as well. Well, Dr. Woodrum, this is for you. In your experience, what mental health disorders co-occur the most with youth substance misuse, substance use disorder?
Sure. So, variety. The answer is a lot of different things, but it goes back to the what I've talked about already today of coping skills. And when folks are experiencing things like depression, anxiety, trauma, so oftentimes substances are turned to cope or numb or suppress some of those feelings that come along with that. So, like I said, depression, anxiety, trauma. Sometimes if other mood-related disorders are present, we might see that. As kids get older and enter more into that early adulthood, later adolescence, we might see like bipolar disorder or schizophrenia being present, and substances again being used to maybe cope just in an unhelpful long-term way, but that's often what we see. So quite a variety of presentations, but anything that kind of is hard to cope with, we tend to see you can see substances being used in place of that.
Caro, we have several people asking this. What advice would you give a high schooler that is about to begin college?
Yeah, I know this may seem very simple, but be smart and trust your gut. I think.
Well, then, there we are.
When you come to college, it can be very overwhelming. You have all these, new freedoms, new things that you get to experience. And the easiest way to get in trouble is not having a plan and not thinking through what you're doing. As soon as you are like, oh, I'll just go do this thing, it could go easily wrong and within seconds. So I think it's, be smart, have a plan, know the stats, know what a standard drink is, know what a correct pill should look like, or, being intentional and being smart when you're out there. If you do choose to participate in, social events that involve alcohol, but just, knowing what is out there, being aware, and trusting your gut. If your gut tells you something's wrong, then maybe you should stop doing that. I know it takes some, common sense, but that would be my best advice.
Yeah, pretty much what we've told them all through school. Trust your gut. Don't do anything you don't feel is right. But it's so hard sometimes, I know. Karen, this is for you. I've had a fairly privileged and trauma-free life, once again from our audience, but I serve as a member for a child that unfortunately does not have the same experiences as I do. How can I relate to and support them despite our differences?
Again, I think we've kind of touched on this quite a bit, is meeting people where they are. And if you haven't experienced a lot of trauma, you're very fortunate. And unfortunately, there are a lot of children, like Lieutenant Shaffer mentioned, because of the opioid crisis, unfortunately, they've experienced more trauma than probably previous generations may have. And so just recognizing the fact that they may be struggling with something, talking about those situations, and making sure that they're comfortable sharing whatever it is that they want to share, but don't dig for it until they're ready to talk about it. Because again, I think sometimes you can do more harm if you're mentoring a child or trying to be a trusted adult, if you push too much, trying to dig things out before they're ready to actually deal with them. So again, meet them where they are. Whatever conversations come up, be very respectful of that child. Don't be reactive again, because some of those things, again, if I haven't experienced them, they may seem really terrible to me. But at the same time, that child may not understand the severity. But just help that child as best you can by just being that listening ear and providing that safe space to let them talk about whatever happened to them in whatever manner is most comfortable for them.
Dr. Shults, this is for you. Do you utilize trauma-informed care in your practice?
We actually started doing the adverse childhood events surveys on our patients yearly to determine the level of trauma, and the Metro Drug Coalition helped us to get that started in our office, and that has helped us. They provided us with a toolkit to look at those ACE scores and how to help the family. We do also have a therapist in our office now and a nutritionist to help with anybody who may need help in those areas. And that's kind of what we're doing. It doesn't take a long time to ask those questions, and most families just want you to listen and help them get help if they want help. And some people don't really want a lot of help. They just want you to listen to them. Mm-hmm. So that's kind of how we've started doing it over the last year.
Dr. Woodrum, this is for you. I recently learned about adverse childhood experiences. Can you talk a little bit about the impact of ACEs, which is adverse childhood experiences, on a person's life, and how parents can stop the cycle of passing ACEs on to their children?
Yeah, so like Dr. Shults was saying, ACEs is a screener, screener that looks at different experiences that a child or a person, as an adult even, may have had up until the age of 18. That can include elements of abuse, neglect, witness violence, etc. And is very common. And what we know too is typically higher level of ACE score is going to result or could result in maybe higher incidence of mental health concerns or substance use in today's topic. And to prevent or try to stop that cycle, it's being very aware for the parent or the guardian of maybe just ways to talk to your child about different ways of coping, that and modeling appropriate kind of coping skills can be really helpful. So for the caregiver, learning that, exploring that within themselves, and talking about things regarding safety, having those conversations about who kids can trust, who kids feel comfortable with, and what to do if a child feels unsafe. Having those conversations with them early. And that can be something that's very helpful to get conversations going and help kids feel prepared for what to do if they feel uncomfortable or unsafe in a situation.
Lieutenant Shaffer, are social workers or co-response utilized in calls that may be regarding an individual that is high, overdosing, or exhibiting signs of a substance use disorder? If yes, how is this impacting our community? And if no, why aren't we doing it?
So we at the Knoxville Police Department, and I can't speak for other law enforcement agencies, but at KPD we have a co-responder program that pairs police officers with a mental health professional, and that's geared toward the mental health side. Now, obviously, we know that, as has been mentioned already, is that substance abuse and other mental disorders can often co-occur, but this program is geared specifically toward mental health and addressing mental health. and oftentimes it is geared towards steering them towards services for follow-up, or potentially dependent upon how adverse their action is at the time, or their disassociation is at the time, may look at an involuntary committal temporarily. And again, that deals more with mental health. There's not anything specific as it stands now, specifically just for substance abuse. There were a couple of programs, one of which was grant funded by another local non-government authority, that we would contact them if we responded to someone overdosing. We would contact them in an attempt to get them to follow up at a later time, maybe when they had come off the high, but they'd come off the overdose, where they were able to make more rational decisions and maybe commit to something. Unfortunately, that organization is no longer continuing that. There are programs at some of the area hospitals that are more prone to see overdoses, where they're trying to encounter them if they go to the emergency department and try to gear them towards services. But as far as in the field, other than if there is a co-occurring mental health disorder, we're not. And the reason is, if someone is overdosing and they're suffering a life-threatening medical event, we're responding as well as the fire department, as well as EMS, and the goal there is life-saving efforts. And so that becomes the priority, and obviously they're being transported to the medical facility. And for a period of time, depending upon what the drug is, they're oftentimes in an unconscious or a comatose state. Even if they're Narcaned, if it's an opioid overdose, that Narcan can wear off and they go back unconscious. So the preference is to get them to a medical facility for an extended period of time. And there are, I don't want to speak for the medical community or for the hospital community, but there are infrastructures in place where oftentimes they can get them with information. If we do respond, if someone is not necessarily overdosing or disassociated necessarily, that we've got resources, or the officers are equipped with giving them referrals toward treatment facilities and resources in that manner.
And then our last question, very, very quickly, Dr. Shults. If I suspect my child is misusing substances, is that something I can discuss with her pediatrician?
Definitely. We actually start doing surveys for substance abuse in 11, 12-year-olds. So we try to open that conversation early so that the child hopefully will feel comfortable talking with us. We try to have the parents step out of the room for a time so that we can discuss sensitive topics, and any way that we can help the parent in discussing that, we certainly are willing to do that.
Wonderful. Well, that's all the time we have for our discussion tonight. Thank you all. I mean, we've had a lot of information assimilated tonight, and thank you for sharing your knowledge and experience with us. Thank you to everyone at home who joined us this evening for this important conversation. If you have more questions on substance misuse in our community, or you or a loved one need resources about substance misuse or anything else that Metro Drug Coalition can help you with, please reach out to Metro Drug Coalition by visiting their website at metrodrug.org, or you can call them anytime at 865-588-5550. My name is Kim Hansard. I've had the wonderful pleasure of moderating this evening. I've enjoyed this panel so much, working with our team here that made all this online possible tonight. On behalf of Metro Drug Coalition and our panel of experts, we thank you for attending tonight's town hall. Have a great night.